Assalamu alaikum. I am Dr. Nafisa Rashid, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Welcome to our online session. Our today's topic is malaria. It is an important topic for your examination because our hilly tracts are very common in case of malaria infection. Now, what is malaria? It is a vector-borne parasitic disease. Remember that it is not waterborne or airborne or sexually transmitted, it is vector-borne parasitic disease. Which vector? It is female Anopheles mosquito. And which parasite is responsible? The Plasmodium genus is responsible for malaria disease. It affects over 100 countries of the tropical and subtropical regions of the world. There are 4 different Plasmodium species and that affect the human and cause distinct disease pattern. Number 1, Plasmodium vivax, number 2, Plasmodium ovale, number 3, Plasmodium malariae, and number 4, Plasmodium falciparum. Among these 4 groups, Plasmodium falciparum and Plasmodium vivax accounts for the 95% of the malarial infection. Of these 2 parasites, Plasmodium falciparum is the most deadly one because it causes cerebral malaria. If it remains untreated, it may lead to coma or death to the patient. 40% of the world population lives in the area which are in the risk of the malaria zone. Now, what are the causative agents? The Plasmodium species, and there is human infection. Plasmodium species number 1, Plasmodium vivax, it causes benign tertian malaria in case of human. And Plasmodium falciparum causes malignant tertian malaria or pernicious malaria. It is most common and most fatal. It may lead to cerebral malaria and black water fever also. Now, Plasmodium malariae, it causes quartan malaria, and Plasmodium ovale causes ovale tertian malaria. Here is a diagram that shows that at first a mosquito is infected, and then if it bites a person, then the person is infected by the mosquito. Then in the liver cell, the Plasmodium genus passes some stages of malaria life cycle or Plasmodium life cycle, and then they come out and infect the RBC. Then infected RBC spreads whole the body, and again if a mosquito again bite the patient, infected patient, then it carries the Plasmodium, and then this mosquito bite a second person, then the second person is also infected. Thus, it is a vector-borne disease from a sick person to a healthy person, and this healthy person becomes infected again. Now, how will you diagnose a case of malaria? Malaria is diagnosed by examining a patient's blood under a microscope. Here you can see that if in diagnostic center a person is diagnosing a malaria parasite under a microscope. When the blood smears are made on a slide, the parasite can be seen. Now, life cycle of Plasmodium. There are 2 stages. One is sexual phase in the mosquito, and there is a sexual phase in human. You have to memorize the 2 points, that in case of mosquito there is sexual phase, and in case of human there is asexual phase. Asexual phase can be clarified into 2 types. Number 1 is exoerythrocytic, it also called pre-erythrocytic schizogony, and number 2 is erythrocytic schizogony. The infectious stage of malaria is sporozoite. This is very important. I again mentioning that this is sporozoite is the infectious stage of the malaria. Where it is found? It is found in the salivary glands of the female Anopheles mosquitoes. Now, all the forms are transmitted by the infective bite of the female Anopheles mosquito. Not only the sporozoite, all the forms are transmitted, but sporozoite is the infective form. Now, transmission through the blood, transmission can be occurred through blood transfusion also, and it may develop disease after 10 to 14 days of being bitten by infective mosquito. Now, life cycle in human. When a mosquito takes a blood meal from human blood, then sporozoites released into the human blood, or sporozoite enters into the human blood and they infect the liver cell at first. That is called exoerythrocytic stage, that means hepatocyte stage. Parasite inside the hepatocyte and they form cyzonte. What is cyzonte? It contains thousands of merozoite. Infected hepatocytes release about 30,000 merozoites and they quickly affect the red cell. Merozoites are asexual haploid forms of cyzonte. Now, Plasmodium vivax and Plasmodium ovale form latent hypnozoites in the hepatocyte, which causes relapse of malaria long after initial infection. This is called the latent stage. What is the name? That is hypnozoite. Now, erythrocytic stage or RBC stage. Within the RBC, the parasites grow in a membrane-bound digestive vacuole, hydrolyzing the hemoglobin through the secreted enzymes. Then they may go any of the following two ways. Number one, they may continue the asexual reproduction or they may produce the gametocyte. If they continue the asexual production, most of the parasites develop into the trophozoite. Ultimately, cyzone and multiple chromatin in the cyzones develop into the merozoites. RBC lysis occurs and merozoites infect the other RBC. And some parasites develop into the sexual forms like gametocyte and infect the mosquito. Some goes to the trophozoite and then develop into merozoite, and some goes to the sexual form, that is gametocyte. Here is a malaria life cycle, that is sporogony. The above half is sporogony cycle and there is schizogony. The sporogony occurs in the mosquito and schizogony occurs in the human body. Here you see that mosquito take a blood meal and gametocyte enters into the mosquito, and then here there is zygote formation and ultimately oocyst formation and there is sporozoite formation, and sporozoite stays in the malaria salivary gland. Then if this type of mosquito bites a healthy person, then the schizogony stage occurs. At first the liver cells are affected and the plasmodium multiplies and schizone form is formed, and then it enters into the erythrocytic cycle and it is an RBC cycle, and here some differentiation occurs and then release the gametocyte, and this gametocyte is again taken up by the mosquito. In my next class, I will discuss about the classification of the drug and details about the drug. Allah Hafiz.